Hi, folks. This is John Adamson, the Rehab and Documentation Guru, back in Virginia, getting ready to go see some patients today in home health setting, and back from a really great tour down in Florida, where I had roughly 150 therapists that came to my course over 3 days. Met a lot of really awesome people. And I wanted to say something, though, about my meeting. I had traveled, as many of you know, to Chicago area about 3 weeks ago and spoke there. And I had already gotten an inkling from meeting so many therapists in different settings about some of the impact of things like PDPM. And this weekend was kind of eye-opening to see some of the impact that home health is already experiencing in some markets in preparation for PDGM. And what was just floored me was to hear the productivity standards that some of these home health therapists are expected to achieve. I asked her several times about this because I was just confused. One therapist shared that she was doing up to 24 home health patients a day, and I said, "How is that possible? How can you even possibly go to that many homes?" And I said, "Are you in like a center where, like an ALF, a large ALF, where you're going, room to room, and that makes it quicker?" Even then, that's astronomically high. When I was working outpatient, I was seeing sometimes 24 patients in a day, but that was scheduling them 3 deep per hour. So, and that's a very high level patient, not a home health patient. So when she said that, I was just like, 24 per day. You don't mean per week, do you? 24 per day. Now that was like way off the charts, but other therapists did confirm that some of their agencies were requiring 14 to 16 visits a day. And even that's like ridiculous. One therapist said she's a therapist. She's seeing 10, but that includes doing evals and things like that. So, I was just blown away by the blatant high productivity, overworking of these therapists. And one therapist shared with me that patients were complaining because their people would walk in, therapists would walk in, and 15 to 20 minutes later they'd be walking out. And by the time you get in the house and you do like your mandated reporting on pain and medication reconciliation, and I always ask if they've had a fall, and you make sure you're actually on target for your goals and you take measures. I mean, that's 15-20 minutes right there. That's just gone. And what I heard from therapists was they were also being mandated to do teaching and focus just on teaching and then turn that teaching over. So anyway, I wanted to say something about that, and I wanted to talk about the fact that all care that we deliver should not be mandated. And one of the things that I've started talking about in my course, is the fact that there shouldn't be anybody directly between you and the patient. Now, while centric care, involves a collaborative effort, when you are doing physical, occupational, or speech therapy with that patient, you and the patient are the most important relationship, and nobody should be inserting themselves into that. So if you are assessing a patient and they need a 45-minute treatment, which is probably going to be a lot of your home healthers, you should be providing that. You shouldn't be shortchanging them on that need. You're going to be ineffectual in that short time frame. You're also going to end up having a longer length of stay with less positive outcome, all against what we would call the triple aim of healthcare, which is positive outcomes, reducing costs, and positive patient experiences. That is the triple aim of healthcare that guides Health and Human Services right now to make all the changes that are being made, starting with the Affordable Care Act and then coming up through further legislation. So it is not it's not a tenable, if that's the right word, I think it is, option to have so many patients on a given day, and nobody should be standing between you and the patient, and you have to do what's right. So a lot of therapists use the words like we are required, we are mandated, we are told, and I always go back to ethics and legality. Ethics, we are the one that is responsible for the best possible care of our patient, and legal, we are not to defraud our patient for the services that they're due. And so if agencies are telling us things that are ethical and potentially even illegal, we are required to not do those things. And so please, as an industry, rehab professionals, we should be standing up in a nice way, but making sure it's clear to those that are dictating, mandating, telling us to do things, that we first and foremost have an obligation to our licensure and the patients that we're treating, and we must do the right thing. And I know in some markets that might seem really hard, but if we all just capitulate, there's another big word, to the powers that be, and just do what we know is unethical and at times maybe even illegal, then we just perpetuate the same problem, and we embolden these provider companies to do what is not right. Anyway, it's been John Adamson, the Rehab and Documentation Guru, urging you to not let anybody stand between you and your patient in delivering what you know is ethical and legal care. Have a great day. God bless. Take care.